All right, Kentucky, good afternoon. We're here on Monday to provide an update on COVID-19. We ought to have a pretty filled agenda today. I want to start by talking about July. July was the toughest month that Kentucky has experienced in terms of cases. Last week was the toughest week we've experienced, with the largest number of positive cases. And unfortunately, that'll have ramifications, because what we find is we lose Kentuckians several weeks to about a month after they test positive. And so having a rough month in terms of overall cases in July will likely mean we have a rough month in terms of Kentuckians that we lose in August. All of that should mean we should be concerned. We're in that place still, right now, where we can become the next Florida, Arizona, or Texas, or we can continue to tell our story as Kentucky, a state that came together, a state that has had better results than just about anybody else out there, a state where we have banded together to protect one another. I want to continue our story as Kentucky and make sure that when they write the history of this virus, that we are front and center as an example of making the sacrifices that it takes to protect one another. With all that, there's reason to be hopeful, and there's reason for optimism, because what the numbers are telling us is that facial coverings and masks are working. That even before we get the impact of the recent bar closure and reduction in capacity in restaurants, before we see the full impact of moving our house parties down to 10 people or less, that the simple act of wearing a facial covering and the mandate, because it had to be mandatory, we're seeing so much more compliance out there because of it, is working. Now, some of you might think, how can you say it's working if we just had the largest number of cases ever in a week? And that's because we were facing what looked like exponential growth. And before we can have a full plateau, before we can start seeing our case numbers go down, you have to slow the growth that's out there. You know, if you're driving at 60, 70 miles an hour, well, those of you like me who aren't professional drivers can't immediately make a full turn. You got to slow down before you can change the direction you're going. And I want to show you a graph that shows our cases by week that I think will tell you exactly how much these masks, wearing a facial covering, is already helping us. So here is our case count going all the way back to June the 8th. And what you can see is beginning on June the 8th, we started seeing pretty significant increases. 4%, not cause for alarm. It could go up and down. And then a 21% jump, a 13% jump, a 48% jump, and that next week was, I think, a 52% jump. What you started seeing there is the exponential curve that we see in all the other states, how quickly those cases go up. This is how Oklahoma got to 1,000 a day, despite having a smaller population than us. This is what happened in Mississippi and in so many other states. And that is the trajectory that we were on. By now, we would have had 1,000 plus cases 1,000 plus cases, I think, almost every day, and our weeks would have looked substantially worse. But we put in the mask mandate on July the 10th, and it takes a little bit to work because cases trail the reporting. People have to, again, go in and get that test, and then you put in something like that mandate, and then it takes a little bit for you to be able to see in the data its impact. And since that week of 52% growth, we have seen a significant de-escalation, a significant decrease in that growth level. Look at that, from 48% growth to 52% growth, all the way down to 4 and 5, which statistically, really close, but a significant reduction and where we would have otherwise been. We talked about when we put this mask requirement, this facial covering requirement into place, that it was going to take us a little bit of time, and again, to plateau and to eventually hit a decrease. First, you've got to decrease the rate of growth, and then hopefully we'll start moving that next direction. But this shows you how important wearing that facial covering is and its impact that it can have pretty quickly. So because of that, because we now can see in our data how effective that wearing a mask is, we're launching a statewide PSA campaign called Mask Up KY with the social media tag Mask Up KY. We know that wearing a mask helps us blunt the increase in cases, but we still have a lot of work to do when it comes to compliance. Going from a 52% increase to a 4 or 5% increase was with most people, but not all people wearing some form of a facial covering. We know that if we can get the vast majority of Kentuckians to wear one every time they go in public when you're 6 feet away from somebody, that we can make a major difference, that we can get close to our old normal. If we want to get our kids back in school, if we want to save our economy and keep it open, if we want to protect one another, lives and health, we need every Kentuckian wearing a mask or a facial covering. It's that simple. We can choose our lives and our health, we can choose our economy, we can choose our schools. We can choose them all simply by putting on a facial covering and making sure you wear it around other people. One of the simplest choices with what we've now seen are, I think, unquestionable results. So over the next couple months, Kentuckians are going to be hearing from a number of their fellow citizens about the importance of wearing a mask. There's going to be a variety of digital announcements, and there's going to be even commercials that will be airing both on radio and on television. Message is simple. Don't put it off. Put that facial covering on. And we're going to show you today what's one of our first ones. This one is one that we could get up quickly, but we've got a lot of some of our most successful Kentuckians that'll be chipping in. I'm Governor Andy Beshear. What if you had COVID-19 and didn't know it? Would you act differently if you did know? The fact is, many Kentuckians are symptom-free carriers, unknowingly spreading the disease to our most vulnerable and holding back our economy. None of us want that. So wear a mask. Help slow the spread. Do it for your loved ones. Do it for Kentucky's economy. Do it for you. Let's mask up, Kentucky. If we're united in this fight, if we not only make the decision to put on that mask, but continue to wear it, knowing that every day we've got to make that right choice, we can defeat this virus before a vaccine ever even comes out. Our choice is simple. Let's make sure our kids can get back in school. Let's make sure that we rebuild this economy and that people get to go back to work. Let's make sure we mask up, Kentucky. We can do this. Let's get it done. So not only is that such a positive sign in what we've seen in growth, but today we have a pretty positive day in our update. Today we are reporting, I'm going to say only, if this were 4 weeks ago it wouldn't be an only, 323 new cases of COVID-19. That's 323 too many, but after having days in the 5s and the 600s, after having a Sunday that was higher than today, this is at least good news for today, and we'll see as we move through this week. Total number of tests that we have now done in Kentucky, 642,577. We have 612 Kentuckians hospitalized for COVID-19, 136 in the ICU, with over 8,335 recovered. Our positivity rate today, 5.18%. 5.18% is down significantly from even a little less than a week ago. It's a positive sign. I was just on a call with the White House, and while they use some different denominators, they are seeing their positivity rate for us go down as well. They are, like us, hopeful. We were thanked on the call for what they described as leaning in, taking the steps that were recommended, and they see in their modeling us moving in the right direction. Let's pray that's true, but let's have the resiliency and the will to make it true. New cases by county, these are ones in double digits. Jefferson 75, Fayette 30, Warren 24, Oldham 20, Madison 13, and Jessamine at 10. Today we have 12 new kids under 5 that have tested positive. Again, a very worrisome sign that's out there from all different counties: Clinton County, Magoffin County, Marion, Fayette, Jefferson, the youngest 2 this time, just 3 months old. So again, lots of different reasons to wear a mask. How about wearing a mask for those 2 3-month-old, or any of those children under 5? Today we're only reporting 2 new COVID-related deaths. That's a 75-year-old man from Floyd County and a 99-year-old man from Callaway County. Again, while we're moving in the right direction on cases, at least we believe, trend-wise we're going to have a tough month ahead in terms of Kentuckians we have lost, because any day that we have those big numbers of cases, with our mortality rate, we're going to lose Kentuckians. It's another good reason to prevent the spread, to wear that mask. Total number of cases now since the beginning of this in Kentucky, 31,508. Total number of deaths, 744. More than we want. Let's make sure that we reduce what will be our final number by as much as we can, and that's by sticking with these right practices every day. Ethnicity of known cases, 85.8% non-Hispanic, 14.2% Hispanic. Breakdown by race, this is just cases. 78.39% white, 12.35% black, 6.07% multiracial, 2.53% Asian. Then on deaths, 95.87% non-Hispanic, 4.13% Hispanic. And then on deaths, 81% white, 14.6% black, 2.77% multiracial, 1.16% Asian. We changed a little bit about how we're going to report our long-term care facilities. We talked about that. Now we're going to try to report the best that we can our active cases and our total cases that we've had since the beginning. So the numbers on the right are what we've been reporting just about every day we've done that. And so when you look at those, we're up 9 new residents who tested positive and 7 new staff, along with, on the bottom, 3 new deaths. But what this tries to do is we as opposed to just having a cumulative amount where we know many have recovered, sadly we've lost some, but staff and residents have gotten better. It gives you an idea of the active state that we are in right now. And again, total recovered is a hard number to have accurately. We're going to do our best with that. But we're being real transparent that that's the hardest one. 2,917 at least recovered in our long-term care facilities. And today, and this is, I'll introduce Dr. Stack right after this, but any day that we can have a positive recovery story that we get to share is one that we need to spread. Today is Dr. Jeff Clark. He's a pulmonologist with the Baptist Health Medical Group, and he's officially been discharged from the hospital after battling COVID-19. We got a quick video. Dr. Clark was admitted to Baptist Health Paducah on July 11th and spent 7 days on a ventilator. He shared that he was grateful for the care he received from the dedicated staff. We played a lot of these, but can you imagine? He probably knows every single individual that's there that he's worked with. This is a pulmonologist who went through this, showing that Again, it can happen to any of us. We have to take it seriously, but we are very excited for Dr. Clark and his entire family. All right, now Dr. Stack is going to share his thoughts about where we are, effectiveness of facial coverings. After that, we'll do a little bit of other positive news. We'll get an update from the Lieutenant Governor on the education side, and Michael Brown will give us an update on the David Macatee investigation.
Thank you, Governor. James, if you could show the slides. I've got a few slides here I want to show you. The first one, and I'm going to qualify this. I think we have a lot to be proud of in Kentucky. It's been hard. It's taken a real toll on us, and I never want to be dismissive of that. I mean, I appreciate all the sacrifices. I've told you it's been difficult having to participate in these recommendations and these decisions we've had to make. I think that the evidence so far is showing we've done a pretty good job steering us through this in Kentucky from a medical standpoint. So on the left side, the green line is New York. And New York obviously was one of the areas that got hit the hardest, the fastest in this country. And you see how high their peak went. And I've already given you numbers over time representing that 0.7 to 1% of all of New York City is thought to perhaps have perished already as a result of COVID-19. So a big peak like that is really, really bad, and a lot of people lose their lives as a result. Arizona is on the right-hand side. It's the blue line. And so you see how high they spiked, and they spiked to a similar magnitude. These are adjusted for population, so these are number of cases per population. And of course, Arizona has not yet seen probably its peak for deaths because that trails by a few weeks, 2 to 3 weeks. So I don't show the death slides on here. Folks can go look at it if you want it yourself. It's on that website that I put at the top. Kentucky's at the bottom. So you see with Kentucky, we had a little bit of an incline, which at the time when we started this, if you didn't have these bigger numbers, it was a big incline because I showed you it was starting to double quickly. We could have been a climb just like New York City, which is green, or New York State, which is green. And we averted that because we did healthy at home and because we took all the steps we did. We stomped on that curve, and by comparison to most of the other states, we flattened it out almost entirely. And then we had that long sustained plateau, multiple months. We have really done a good job in Kentucky about keeping the disease at bay, and that's because of you. That's because Team Kentucky listened when we asked you to do things. When we made these difficult recommendations and requirements to keep us safe, we kept the disease at bay. But then you see on the right, we started the climb. That climb could go a number of different ways. It's sort of a choose-your-own ending storybook, so to speak. And in this case, if you look, we now appear to have flattened the curve again. It's at a higher level. But what we could do is if we keep doing these things, like we've asked you to, wear a mask, keep your social distance, and we've had to do other steps like close the bars and restrict the restaurants because those have been shown to be higher risk. Because we've done those things, and this is mostly the impact of the masks at the moment, because 1 week's not long enough to see all the other benefits from the other actions, we've flattened that curve. And you see that if you take these steps, if you take the right steps and you do them consistently, you can flatten the curve all the way back where New York was, and then we're back like we were before. So our hope will be over the next 7 to 10 days to see that curve not only stay flat, but hopefully go back down again. If we do that, we will have shown a second time that we have been able, through our actions, to control our own destiny. So I know it's difficult, and I want to just thank you and encourage you to please help us stay the course, because if we calibrate these things better and we work together, and the biggest things are the masks and the social distancing, we'll be able to return as much as possible to our activities that we all want to get back to. James, if you could show the next slide. I only show, was there one before that? Yes, thanks. I only show this because I want to show you that this shows all the states in the District of Columbia. There were a number of states on the far left that were early peakers, and there were a lot more states on the right side that were later peakers. And so far, we have not come anywhere near the heights of many of those other states, either early or late. Now, please don't get complacent, because if I showed you the different map from the federal government's weekly update now, and one of the reporters present in the room already shared this in one of their articles or a version of it. It is a wall of red to the south of us. If you were looking at a hurricane, the whole hurricane is in the southern states beneath us. If you get complacent and you think, things are good, we don't have to do this stuff, that wall of red moves into Kentucky and Kentucky turns red. So please stay the course. And the next slide. This is just one more last point I want to share. We've talked about the many things we don't know. And of course, with school about to start and all of our desire to get back to activities for students and their learning, which are clearly a very, very high priority for us. There's a lot we don't know yet about kids and how it spreads and what that will do to the rest of communities. And there was a YMCA camp that operated in Georgia, and it had kids all the way down to, I think, 6 years of age, all the way up to young adults in their early 20s who are camp counselors. They followed the rules mostly, but not entirely in Georgia. And what they did was they required everyone to have a negative test within 12 days of arriving at camp. They did a number of other interventions, but one thing they didn't do is require all the campers to wear a face mask. And because the campers weren't wearing face coverings, perhaps that contributed directly to this. They found that within 6 days they had an active outbreak happening at the camp. And through the time that the CDC published this report on July 31st, 44% of the campers had become infected with COVID-19, 44%. And not everybody was tested. They were only tested 3 out of 4 people. So it could, if anything, that's an underestimate of how much the disease spread. And so it spreads like wildfire, and hopefully these children and these adolescents will be fine. But we also have to be concerned about their parents, their grandparents, and all the other folks that they come in contact with, the people they love and they want to give a hug to, and the risk of spreading that infection. So we'll keep trying to find ways to calibrate the interventions we do. We'll keep trying to find ways to be healthy at school and work to make sure all of us get back to our activities. But please, I hope the previous slide showed we can beat this if we work together. Thanks, Governor.
All right. So we got to remember hands, face, and space. Wash those hands. It's important. It's as important now as it was when we started. Wear that facial covering. Stay 6 feet apart. Remember that the best thing that we can do to battle COVID-19 is to prevent it from spreading. A test doesn't keep that current person from getting it, but staying 6 feet away, wearing that facial covering can. But testing is incredibly important, and this week is our first week without having our Kroger drive-through. So Kroger may be helping us out a little bit in the interim. So I want to talk about the testing options that are out there because there are so many. kycovid19.ky.gov is the source that you can go to and find testing in your region. We have over 225 locations right now where you can get a test. And so what we'd hear is, this one or that one may be full, but 225 locations. Every single one registered on the website with how you go to that place and get an appointment. And this breaks it down by region. Just about every region of the state, every region of the state has at the very least 29 different options on where to go to get a test. So please make sure if you need a test or if you want a test, if you're about to go back to work, if you haven't had a test in a couple weeks, please go get one. So this is the present. This is as of today what you can do. Now let's talk a little bit about what's coming in the future. We are working with some new partners to ultimately replace those Kroger drive-through sites. This one is one we are working on in northern Kentucky with St. E's. We are going to make sure that we get it's going to be Monday through Friday. It's going to start this Thursday. So we will, tomorrow, is what we hope, have the way to sign up. This is a northern Kentucky drive-through testing where we believe we're going to do about the same number every week that we did in the Kroger. This is a joint undertaking between Gravity Diagnostics, which is one of the major labs we use, and St. Elizabeth Healthcare, Louisville. I put a picture of his kid up the last time, and now I can't get the slide up. There we go. So we're proud to have a new partnership with U of L and U of L Healthcare, where they are going to set up 3 separate sites. These were the sites that they could operate out of to ultimately replace that level of testing from the Kroger drive-thrus. And in fact, we think we're ultimately going to test more folks because of this. This phone number won't become active until tomorrow. But you're going to call this number, 502-588-0414, to sign up for any of these 3 locations, downtown Louisville, South Louisville, or in Bullock County. In addition to that, we talked today with Norton Healthcare, who, as you all know, had written to both the federal administration and to our administration about the difficulty getting testing supplies. We're going to be increasing the amount of our test kits that we provide to Norton, and they're going to be able to use that to continue the community testing that was truly at risk. We're going to have an announcement for Lexington testing here in the next, we believe, few days, working with the University of Kentucky to help shore up testing there. So we're going to make sure that we preserve the capacity that we had with those Kroger sites, and Kroger isn't going away. First, we ought to thank them. At a time when we couldn't get these sites up and running, they were there for us. They never charged us for their people, for the PPE. They worked through brutal heat. They were truly guardian angels for this state. They're now going to do their testing out of their little clinics. And it's going to provide over, I think, 40 plus locations across the state where they're going to be able to do a significant capacity each day. What you'll do is you'll sign up at that little clinic online for a test, and they'll come out to your car. So Kroger isn't going away. They're just changing the method by which they're doing it, and we owe them a huge amount of thanks. One of the best citizens, much less corporate citizens, that we have had in this fight against COVID-19. So again, if you can put up the map of the regions with the numbers of different testing sites there's no excuse if you want to get a test tomorrow. There are so many different areas and places where you can right in your community. Make sure you sign up. Having robust testing tells us where we are and protects you and protects your family. But remember, if you go in and get tested, that test can't change the outcome. It can only tell you whether you have it or not. Hands, face, and space is how you protect yourself. I'm now going to ask the Lieutenant Governor to come up and give us an update on education, and I think yet another step that we are taking to provide more flexibility.
Thank you so much, and thank you, Team Kentucky. I wanted to first kind of rehash some of the executive orders and the changes that we've put into place to make sure that schools have the flexibility that they need to meet the needs of their students and the families in their communities. The very first executive order was to extend unlimited NTI days so that if a school district decided to begin the year digitally or to revert to digital days, they have that flexibility so that they have as many as they need to use throughout the year, depending on how the virus continues to evolve in the state of Kentucky. The second executive order that was issued was we removed the average daily attendance requirement for funding. The key to this is our statutes are written as if every student is in school or every student is out of school, like for a snow day, for instance, and that is how our schools are funded. So by waiving this requirement and allowing funding to flow to our schools, it also allows our schools, if they decide to use a hybrid model, where some students are on campus in school some days and some are on other days. So that allows that flexibility as well. We have talked about the expanded care program. That's a 3-to-1 federal match that exists for our school districts for physical, behavioral, and mental health services that we can extend to our students. And we have talked endlessly about the need for mental health services for our students, especially through a time with such anxiety and isolation as we have been through over the last several months. And so we want to remind school districts that that is out there for them to be able to use. It expands expands the amount of students that we can cover with Medicaid to about 75% more than we had before. So please, school districts, take advantage of those services for mental and behavioral health services for your kids. Let's see. We signed an executive order to allow flexibility for schools in terms of extending an unlimited number of COVID-related emergency days. And the reason that's important is for those schools that return to in-person classes, we want to make sure that our teachers are safe, as well as being able to use these emergency days to quarantine if they are exposed to the virus. And so we wanted to make sure that that extension was given to our school districts, and our school districts can utilize that flexibility as they need in their local areas. Lastly, today I'm going to announce a new expansion that we have allowed. A lot of these school districts are going to digital platforms that they are using for their students for their NTI days. One of the requests we got directly from the education community was, can you help us create some flexibility with who can help to facilitate and support students on those digital platforms. As the older that you get in school, the more specific your teacher's certification is. For instance, mine was social studies, so I only taught social studies. But what this allows is, if I'm in a school district where they have surveyed us and I'm a teacher that needs to stay at home because I'm immunocompromised, then I can support and facilitate this online platform across the curriculum as my school needs me to, perhaps for students who are also staying home. Now, that is not to say that I would be the main deliverer of instruction, but it does allow that flexibility to create support and facilitation through those online learning platforms that our students are likely to depend on. That's a flexibility that our schools have asked for and that they need. And so I want to remind everybody that all of these are possible because of the executive orders that have been signed into place, and the goal of all of these was to make it as flexible as possible so that our schools could meet our students and their families where they are. Thank you.
And I will add just one addition to that all of these executive orders were signed under the emergency powers that are granted to the governor to deal with this type of crisis. And should that authority be invalidated, because more than a couple of lawsuits have been filed to try to do that, all this would be lost. We could be in the middle of the height of this pandemic, and schools would only receive state funds based on the number of kids that go into their classroom at a time, potentially when they shouldn't be going into the classroom. That teachers wouldn't have the extra days off if they were even quarantining for COVID. I mean, these are things that we absolutely have to have during this period of time. And I hope we all realize both that and the ramifications of what happens if that authority is not preserved. Real quickly, our ability to get back in school depends on our willingness to follow the rules we've put out there, wearing that facial covering, staying 6 feet apart, doing the things that Healthy at Work and Healthy at Home. And I just want to highlight a couple of folks that are showing online how much they care about getting this right, how much they care about people around them. So the first one is a couple of kids in Howardston, Kentucky, that have been ringing the bell of St. Anne Catholic Church every day at 10 a.m. since March. That's pretty special. It's also the resiliency that we need. This resiliency is telling people that have lost or who are lonely, maybe the lost, lonely, and left behind, that we are with them. Even if they can't see us, we are with them. And I keep thinking about individuals that are immunocompromised, that fall into danger categories, that may have even been holed up in their house alone since March. And if they can hear these bells every single day, what that must mean. Okay, this is Farmers Market week that we're celebrating here in Kentucky. And look at this photo. It shows that you can do it right. Every single individual wearing a mask. You can just barely see gloves on those that are working. There are ways to get back to our old normal, and this is one good example of it. And finally, this might be our spokesperson for Mask Up Kentucky. I mean, look at the ability to have fun. You can see even though you can't see that this kid is smiling. You can see it in the expression in the mask. I'm trying to show a little school spirit today for my son and his new school system. So there's a real opportunity here to have a little joy in doing the right thing. All right, I'd ask Michael Brown, who is the Executive Secretary of the Cabinet, who has been providing updates on an investigation by the state police into the shooting death of David Macatee, and he's got another one today.
This afternoon, the governor has asked me to give an update on the status of the investigation into the death of David Macatee, which occurred in the early morning hours of June 1st. The governor got that call in the very early morning, sometime around 3:18. I know that for a fact. And he vowed from the beginning that there would be a quick, thorough investigation committed to the truth. The community, all who were involved, and all the families of all who were involved deserve the truth. So also on June 1st, the governor authorized the Kentucky State Police Critical Incident Review Team to investigate. They immediately coordinated with Louisville Metro Police and began to work on the investigation. June 2nd, I came before you and gave a report that included a preliminary autopsy. It indicated that Mr. Macatee had succumbed to a single gunshot wound to the chest. By that time, there was a series of surveillance videos that had started to circulate. I came back on June 9th, and at that time I was able to, along with those videos, report that the Kentucky State Police Crime Lab had been able to identify that from the fragments of the bullets inside Mr. Macatee, that he had been hit with a military-issue .556 caliber round, which had to be fired from one of the Kentucky National Guard issued M4 carbines. The round was fired by one of two Kentucky guardsmen who were returning fire from Macatee that night. I indicated at that time also that because of the fragmentation, it would be unlikely, if not impossible, to identify which weapon the round actually came from. The videos from inside Yaya's clearly showed that Mr. Macatee was armed with a handgun that night, which could later be seen falling to the ground after he had been shot. I reported that Mr. Macatee had gunshot residue on his hands and that 2 expended shell casings found immediately outside the doorway had been tested and found to have been fired by that gun. Today I am reporting that the Kentucky State Police investigation is substantially complete and is now being turned over to the Jefferson County Commonwealth Attorney's Office for review. That file is also being shared with the Federal Bureau of Investigation. Although they are conducting an independent investigation, they can use our files as resource. The file is not closed and will remain open until the review by the Jefferson County Commonwealth Attorney and any potential follow-up he might ask Kentucky State Police to do. This investigation has been comprehensive. It includes more than 170 interviews, KSP lab reports, and information obtained from federal agencies. With all of that, it's all cumulative in the sense that there's nothing to suggest from the evidence collected so far that there's any significant difference between the sequence of events and actions that was previously reported or captured on the videos. The United States Attorney has formally requested that we forego any further public release of information gleaned from our investigation until the federal investigation is complete. We will, of course, honor that request, and the federal agencies have assured us that they will make this a matter of high priority, and they are applying significant resources to their investigations. Thank you.
All right, we will open it up for questions. We have a full house here in the Capitol Rotunda today. We'll start over here on my right with Tom Latek.
That is, positive antibodies included with all the rest of the positive testing.
Dr. Stack? So on the website, we break out all different types of testing. The question was about a specific antibody test. Again, our goal is always to be as transparent as we can be. Lawrence.
You mentioned that the PSAs will be running for several months. You anticipate the mask mandate will be continued for that period of time for several months ahead?
The PSAs will be running in the months ahead. We can expect the requirement to wear a facial covering to be extended beyond the initial 30 days. We'll see how long it needs to go or it needs to be mandatory. The more effective that we continue to see it is, I hope encouragement alone will work to get people to wear one. But there is no question that since the mandate was put into effect, we have seen significantly more people wearing them. And at the end of the day, what I really want to do is protect as many people as I can, protect our economy, and get our kids back in school. And if that means extending it, we will. I'm sorry, I missed Jack?
Yes.
Anything?
Is the state prepared making preparations to make any further recommendations to colleges?
Question is the state preparing any new recommendations to colleges in the fall? I know we have regular calls with them where different questions are answered. I don't believe at this time we expect any new additional guidance to come out, though they certainly provide the different plans that they are working on to us for different commentary on. Karen?
Today, Dr. Burns talked about concern about the virus spreading into rural areas. What is your concern and thoughts so far here in Kentucky, and what's being done to proactively prevent that from happening?
So today, Dr. Burks, talking nationally, commented on how there is significant rural spread. She commented on that specifically in Kentucky during our meeting, commented that with over 70-something counties being in their red or yellow, those are their danger counties, that our outbreak was statewide. And the White House's advice on that was that our steps that we needed to take to stop it must be statewide, that we could not address this regionally or county by county in a way that would be effective. Vice President, right before we came out here, referenced in a call with all our governors that he agreed with our approach and the need to take it on a statewide manner, and Dr. Burks has continued to say that's important. We're seeing rural spread. I mean, you look at, and while I hope they're leveling off, Harlan and Bell counties hit really, really hard. We've seen that in different areas in the past, but they're one of the starkest examples. But this can happen anytime, anywhere. Graves County also had a significant outbreak. I believe Fulton County may be on their red list for the increase in cases. We are absolutely seeing it in rural communities as well as urban communities. Everybody needs to be doing the right thing. Yes, so the testing is statewide. We have those 200 plus locations, and they are everywhere throughout Kentucky. If you look at eastern Kentucky, for instance, we have 66 different testing sites. What we do need is encouragement for more people in all areas of the state to take the test, just like to wear the facial covering. We need everybody to buy in. It was of some concern the last time we had a Kroger site in Madisonville that we weren't coming anywhere close to filling it. We'd like to think if we'd set up a drive-through site anywhere right now, we would fill it with where we are combating the virus. Joe?
Do you have any update on the numbers of outbreaks at state prisons, and is there any consideration of conducting mass testing before there's a positive case at any state prison?
Can you ask the last part of that question again?
Has there been any consideration to do mass testing at state prisons before there is a positive case?
There was a two-part question. The second part is, has there been consideration to doing testing at prisons before we have a positive case? While I haven't heard of a decision or a recommendation coming to me on that at this point, I think it's something that we should seriously and significantly consider. The challenge can be the overall numbers. We are working on a possible testing based on wastewater coming out of the prisons. If we're able to do that, we will know pretty quickly if there is a single positive or any level of positive cases. Right now, that appears to be our best surveillance method to test that water coming out. And then, do we have an update on the exact numbers, Michael, or can you get that while we're here? Okay, I want to make sure we get you the most recent. Let's see.
Employee today that made an appointment for testing in Lexington 10 days ago. She showed up for an appointment today. She waited 3.5 hours. We have another employee that...
Where was it?
This was in Lexington at Southland.
Okay.
We had another employee that was tested 13 days ago, has still not received his results. Are you getting any feedback? Are you hearing about other cases like this that are popping up, or is it on your radar?
We see across the state at some points there are concerns with the lag time in testing versus receiving results. It's mainly one lab, Quest, that has a substantially long period of time that they are trying to get under control. LabCorp had gotten, we think, too long, but they have made a commitment and appear to be getting it back in a more acceptable range. Our challenge is the number of labs, is without knowing exactly who was running which clinics that people were going to or tests. It's hard to address the specific situation with the specific lab, but we're happy to do that. We don't want people who are getting a test to get the results 7 days later. That doesn't help. For us, we want to see a 48-hour turnaround maximum. That's what we ask of all of our Kentucky labs that we work with, and that's one of the reasons we push out the gravity tests and the others that are there. We haven't heard a lot about the delays in getting tested, but if we want people to show up and get tested, they can't have to wait 3+ hours.
Have to wait more than 48 hours for their test to be returned?
So it still does some good if they get their results in 3 or 4 days, but 2 is a lot better. We don't want to make this process disrupt people's lives being tested so much that they're unwilling to go get the test. And really, if you're going to get tested, and it's not just for self-monitoring, if you're going because you got a symptom and we're asking you to quarantine, we want to make sure we do our part and get that back to you as quickly as we can, because if you're somebody like me, you might have isolated yourself from your kids, and your spouse is going nuts because they're having to deal with both kids, and/or those kids really want to see you. I remember having at least one test, waiting a day, and making sure that I was far enough away from my kids. I was negative, but having been there and knowing how hard that can be. Chris?
I had a testing question as well, and maybe if Dr. Stack is here, he might. I can dovetail off of that to ask my question, because I've been hearing about delays. Some people waiting 2 weeks for test results and getting very frustrated that they're quarantining and don't have an answer. But a question about the stats, Dr. Stack: are antibody test positives being lumped in with the new case totals that we're seeing on a daily basis? Or would an antibody test not be considered a new positive case in Kentucky?
The question is how we count. Well, I think there's 2 questions. One is about how long it takes for some tests to come back, and then the other one is about how we count different types of tests. One of the things I learned when I practiced medicine for a couple decades and ran emergency departments is each one of these cases, unfortunately, requires us to kind of look into the facts related to them. So the governor's already addressed. We know that there have been instances where some labs have developed queues and gotten behind, and some of those delays have been substantial. It tends to be more the national labs that are supplying services for the entire country or enormous parts of it. It is much less so been our local labs, and our local labs in Kentucky, we think, have been doing a pretty good job, for the most part, getting the test results within 2 days. So we think the Kentucky in-state labs are doing a pretty good job. As far as how we count the tests, the only ones that are counted as confirmed positive are PCR tests. So those are the Q-tip in the nose or the back of your nose. The antigen tests, which are different ones, you can get point of care, like if you go to an urgent treatment center, is a common place, or a doctor's office or clinic. Or the serology or antibody tests are only considered probable, and you only get to be called probable after we've done your interview and determined you either had symptoms that were consistent with COVID or that you had a close high-risk contact that made it likely you could have had COVID. because those two tests have other limitations, and so it's more complicated. So we count them in the total number of tests we provide, but they show up as probables only if they had some other criteria, such as symptoms consistent with infection or a high-risk exposure, to also add additional data to support it. Does that help?
So there would be no way that someone could test it with a PCR and an antibody test and be counted twice?
No. So remember, we talk about this, the governor mentions this. When we report total numbers of tests, there are duplicates in it, and that's why the positivity rate, depending who you get it from, it varies, and why we keep telling you use Kentucky's numbers for Kentucky's data. But when it comes to the total number of positives, we do deduplicate those. So we actually identify a test with a person, and if the same person got tested 5 times, they only get reported as a positive case once. So our total cases, which are, the governor knows some of these numbers better than I do, the total number are less than 30,000 or somewhere in that ballpark. Those are all unique individuals. Yep.
And the deduplication could be seen. We originally had some questions a long time ago, if we go back to March, and how you couldn't just add today's positive case number to the overall number and get the new number. And that's because we dedupe every night. And as I'm answering other questions, I think I can find, we actually didn't have any for today's report, but we've had 22 or more at different times in the past.
My question is for Dr. Stagg. Referencing the graph that you put up in New York and Arizona, did you say that Kentucky has already surpassed the spike in cases because we get to
Okay, question for Dr. Stagg. He's popular.
So the question was, I showed the graph. James, could you show that real quick? The big spike for New York on the left, the big spike for Arizona on the right, and then the question from the reporter is, do I think that we have averted that second spike? Is that fair? So I hope we have. But the problem is those curves can take a lot of different shapes. You could do a vertical climb, you could do a stair step, and you could go up like this. So we won't know. That's why I always qualify these answers. You have to be careful what you say with certainty. We hope that that's going to start going down, and that's going to be our top spike, and then by comparison to other states, it will look like a hill, not a mountain. That's our hope, but we won't know until we look back.
Are you pleased with where we're at?
Yeah, obviously I wish we would have a lower number than that, because that would be even better. But compared to what other states have gone through, yes, I think the things that the governor has asked us to do have directly contributed to better results in Kentucky.
And if we'd put Louisiana up, they have both. They had the spike in the beginning. Remember, they were one of the first hardest hit states, and they're in the midst of a second one now. So I think we've got to be vigilant and understand that we got to beat this thing. And we had to beat it in March and April. We've got to beat it today with what we're asking, and we're going to have to beat it all the way up until when there is a vaccine out, at least from what we're seeing now. This concept of there being one or two waves, it doesn't appear to go away. And so we got to constantly be fighting it to make sure we stay flat until we get an effective, safe vaccine, and we don't have to worry about this anymore. Tom?
New cases dropped by over 100 each day since Friday. It's 744, and it's 600, 500, now 400. How does that compare to the number of tests?
So the question is, with the numbers going down the last 3 or 4 days, and that's always tough through a weekend. Some Sundays we have a ton of tests come in, and others we have very few. Sometimes the fewer tests are on Monday. The weekends are really hard to gauge, and so we'll have to look at Tuesday, Wednesday, Thursday. But our positivity rate is down. This is really the lowest it's been in really a week, though I think yesterday it was 1/100th of a point lower than it is today. But watching that positivity rate really removes the numbers of tests versus positives and gives you a real idea. And that's going down. So that's a real positive. Now, when UK welcomes all their students back in, if they do 30,000 tests of people in their 20s, And we might see an increase in cases because of that. I want to show a graph tomorrow of changes in the age demographic breakdown that we see, say, from 2 months ago to today, because it's a lot more on the 40 and under side. But the experience in Florida and in Alabama is it starts like that. And then it jumps to their parents and their grandparents, and that's the true spike. Lawrence.
Tennessee is at a considerable increase in cases. They're considering adding them to the travel advisory.
The question is, are we considering adding Tennessee to the travel advisory? Right now, the travel advisory is numerically constructed. It is states over 15%. We do have an update today on those states. Some have fallen off, some have been added. So as of today, and these are just states with a really, really high rate where it's really dangerous to go. Alabama, Arizona, Florida, Idaho, Nevada, South Carolina, Kansas, and Mississippi. Let me just say, there is a beach that I love, that my family loves, that it is one where we look forward to going every year. Sometimes we go multiple times. It is not worth it. It is not worth it to put my family in danger. It is not worth it to put other people around me in danger. It is not worth it. I keep thinking that if somebody asked me, would you go to the beach if it meant it might kill someone in your family? And that answer is heck no. And then somebody might say, well, what if it kills somebody not in your family? That answer ought to still be heck no. But if they'd say, well, what if there's a 2% chance it'll happen? That answer ought to be heck no too. So let's continue to cancel our trips if they're to these dangerous places. Whether it's your patriotism, whether it's your faith, we just need you to do it. Karen? Texas, I believe, is below 15%. I still wouldn't go right now, but they are headed in a better direction.
Coming from a hotspot or coming in contact, are you still recommending under normal circumstances being tested once a month?
The question is our recommendation on how often people are tested. I will say right now, our office is tested every 2 weeks. And I will say for 2 straight weeks, everyone that's in our program has been negative. And I think what it proves is as you all walk in, you get the temperature checks. Obviously, they have to listen to all the steps to fight COVID every day, and we all sit around and wait for the numbers. So you would expect us to maybe be a little hyper-vigilant, but shows that we can do this right. Once a month, I think, would be the longest that I would go, especially if you're out there interacting with a lot of people. If I was working in a restaurant or ultimately a bar when it reopens, I might do every 2 weeks, just because you're around so many other people. And it's just taking care of yourself and taking care of your family. Joe?
You mentioned that Kentucky got a positive mention in the White House call today. How would you grade, how do you think President Trump has done personally in dealing with the COVID-19 crisis?
The question is based on our White House caller. Generally, what grade would I get the president in dealing with COVID? I've tried during the course of this not to Monday morning quarterback anybody, whether it's other states or the president. I have mentioned that we really need the president to wear a mask, that if the president would routinely wear a mask, then there's probably a couple 100,000 Kentuckians that would wear one too and would better protect them. We have always gotten good advice on the calls and the communications we've had from the COVID task force itself. Certainly Dr. Birx was a person of her word when she came, made the recommendations, stated them publicly, and continues to support them. Are there things that I would have liked to see the White House do differently? Sure. Were there things that they would probably like me to do differently? I'm sure of that too. But my goal is to do the very best with what we got, and that's what we try to do each day. But I will say that we have received support from Dr. Birx. Secretary Azar was on the phone with us the other day about supplies that we don't have. The communication, I would give them a positive grade on. The work towards a vaccine, I'd give a positive grade on. And then I try not to Monday morning quarterback the rest. Oh, let's see. We lost everybody else. We want one more? Then we'll wrap it up.
A week ago today was the institution of the pre-closure for bars in Kentucky. Are you planning to maybe extend that
So our hope is, with the next week as it comes, that we will be able to provide additional flexibility for our restaurants, additional capacity. We'll want to see what that looks like. I will say that all around, whether it's here in Frankfurt as you drive by Cliffside, we are seeing an even bigger effort to increase outdoor seating. And we want to, as long as they can be safe, certainly put our restaurants in a better position, but I don't want to do anything, I will say, to decrease the amount of additional outdoor seating because it's always going to be better off. On bars, we hope that we can have better, stronger guidelines, and we will have to see where we are as we approach that point in time. We may also have to consider a curfew, a closing time, because that appears to be semi-effective, at least in other states. Tom?
On the second floor, though, with the Supreme Court chamber, they're spreading out. They're planning to go live for the first time in several weeks up in the chamber. They're spreading out. There'll be 3 of them. You will see the 7, and then they're spreading out over the tables today. You go along with that, or do you think they should still be doing this?
The question is on the Kentucky Supreme Court, apparently going to restart arguments, really spread out in that chamber. It is a big chamber. It's one that we held briefings in because it let us have more people in it. I think that if they follow the guidelines, everybody wears a mask unless speaking, and really you can speak through them pretty well. Steps are taken with those that have pre-existing conditions, and the capacity is kept very low. My guess is that they're just going to have the lawyers in that are arguing the cases. Then I think it can be done safely, and the press. But I take it they're also going to participate in what we're doing building wide here, where we do the temperature checks and wellness screens every day. Lawrence?
With substantially over, is it still the case that you cannot tell who fired, which guardsman fired the shot?
At this point, we have been asked not to further comment on the evidence in the Macatee case by the U.S. Attorney. I will say that none of the evidence or what appeared to be the facts as they were described before by Michael Brown appeared to have changed based on anything new that we've received. Now, it's been turned over to the Commonwealth Attorney, and so people know exactly where it is in the process, and there is a separate ongoing federal investigation as well.
Are you allowed to say whether or not the children 5 and under are mostly asymptomatic or the level of severity of their illness?
We'll need to check on that. The question is the children under 5, are they primarily asymptomatic or otherwise? We have heard from our hospitals they're getting more young children, but with the level of young children testing positive, that's something we would want to dig into. I can say the vast majority of them are not hospitalized. Now, what we found early on is kids would show symptoms, but they'd recover really quickly. And the younger the kid, it seemed like they recovered quicker than we had some teenagers that had a slightly rougher time. But that's really anecdotal based on a dozen cases at most. All right, Joe, finish us off. I believe that none of the facts as described, at least by the evidence at that time by Secretary Brown, have changed. I think that people are able to watch the video that's out there and to make their conclusions. And I believe any of the procedures or actions taken by law enforcement are going to be reviewed in the course of the analysis by either the Commonwealth Attorney or by the U.S. Attorney. All right, so more cases than we want, but these facial coverings are working. We got a chance right now, if we continue, to wear these every day, every time we're around other people, every time you're 6 feet or less outside, and you really ought to wear them inside except when you're with your family unit. We can stop not only the growth, but we can ultimately cause a decrease in these cases. We're going to be back at 4 o'clock tomorrow, given the situation we're in, where we simply must see better case numbers. And I think we are on that path. We want to make sure that we're providing you information just about every day. But I anticipate that we'll go Monday through Thursday this week. If we start seeing better numbers, that might change, but we'll be back here tomorrow at 4 o'clock. Everybody stay safe. Thanks.